Yeah, you can't be getting preventative advice from Western doctors, in my opinion.
No, you can't. No, and if this advice worked, we wouldn't be in the midst of the obesity epidemic that we are. And it is global. As much as we want to think this is just a Western, even U.S. problem, far from it. The rates of diabetes and obesity-related pathologies are even, the U.S. isn't even in the top 20 when it comes to type 2 diabetes.
Wow.
You look across Southeast Asia, look across even North Asia, look across the Middle East, almost all of those countries are higher than the U.S.
Dang, I didn't know that. I thought we were one of the worst.
I know. It's a uniquely sort of American thing to think that the U.S. is the worst, but we're not.
Yeah, just because of fast food and everything.
I know. But like I said, it's global.
Yeah.
You know, my beloved Singapore, where one of my kids was born there. We love Singapore. Talk about fast food. Oh, my gosh. It's everywhere. Everywhere.
So they're doing studies on obesity, and by 2030, they're saying 1 in 2 people will be obese. That is crazy.
Oh, well, it even gets worse. So my most clear area of expertise is a problem called insulin resistance, sometimes referred to as prediabetes. Most people have never heard of insulin resistance, but it is the single most common health problem worldwide, and it contributes to all of what I refer to as the plagues of prosperity. All of these chronic diseases that were once unheard of. You know, people dying from heart disease, breast and prostate cancers, Alzheimer's disease, type 2 diabetes. What they all have in common, even forms of infertility, low testosterone, erectile dysfunction, polycystic ovary syndrome, what they all have in common is that insulin resistance contributes or directly causes every problem.
Wow.
So the reason I beat that drum so loudly is if we could focus all of our energy on one single thing, we can start to reduce the risk of literally every chronic disease. And in this case, the focus on insulin resistance is important because it precedes the obesity epidemic. So as someone is on that spectrum where they're getting chubby or now they're fat or now they're obese, long before that ever started happening, they were insulin resistant. And so before they ever became obese, they were told they had fatty liver disease or they had high, dyslipidemia, all of these problems that are sort of precursor warnings to a more chronic problem. But the main reason it's overlooked is that we look at metabolic health on lab tests purely through the lens of glucose. We have a very glucose-centric paradigm to metabolic health. And so you'd be going in, or you'd mentioned that your grandpa had type 2 diabetes despite being fairly lean.
Super lean.
And of course, he's Chinese ethnicity, which automatically brings a higher risk at a lower body fat. But I bet he would have been going in year after year for his checkups, and his glucose levels would have been normal, his blood sugar, normal, slightly higher, now really high. Even when the glucose levels were normal, the insulin levels would not have been. Insulin is the canary in the coal mine metabolically. It is the earliest signal that we're headed down into this metabolic disarray. And so as much as we've had a glucose-centric paradigm, and glucose has value, but not on its own, it is the Robin to Batman in the story. It's the sidekick.
Wow.
Insulin is the main character we need to be focused on. So if we could shift the clinical paradigm away from a glucose-centric perspective to an insulin-centric perspective, insulin can be elevated up to 20 years before the glucose is ever rising.
Holy
Just
crap.
imagine if we can start detecting the problems years in advance and then start to make some changes and then get them off that path and keep them on a healthy path.
Yeah, that's an important message. Because you hear about people going gluten-free, but never talking about insulin problems.
No, that's right. Yeah, so as much as people want to be monitoring their blood sugar, and again, that has value, we have to include insulin in the conversation because insulin's main job, its most famous job, because it does all kinds of things, its most famous job is to control blood sugar. Blood sugar levels go up. If that stays up, it becomes lethal. Insulin comes up to basically open doors into cells to allow the blood sugar to come back down, pushing that sugar into the cells. And then insulin, having done its job, will retreat back into the background. But in this case, the more the body has to fight to keep that blood sugar under control, the higher and higher the insulin gets.
Got it.
That is insulin resistance, where the insulin is elevated, but the glucose is still normal. And so our paradigm focused on the glucose has no regard for the insulin. We're just waiting for this to go up.
How could people monitor their insulin, and what are some recommended ranges you recommend to be in?
Yeah, great question. In fact, I'm very grateful we can focus on this because it is the drum I beat the loudest, that we have to include insulin in these clinical conversations. Yeah, unfortunately, insulin is not easy to measure. No hormones are. There is no way to simply like where you and I could do it on our own, like in our own home. Like with glucose, we could prick a finger or slap on a continuous glucose monitor, and we could be monitoring our glucose at every moment, literally every minute. Any hormone we're years away from that type of technology. So there are some at-home tests that people can do, and I have no vested interest in saying this. There's companies where they'll send you a little kit, and you just prick your finger and then send it in. That's a company called Siphox, Siphox. But most commonly, it's you going into a clinic and just telling your doctor, look, I know you're not going to measure my insulin because no one does. Please check that box, because every lab can do it.
Yeah.
It's just a matter of insisting that it get done.
Is it on a blood test?
Mm-hmm.
Okay.
Yep. So next time someone goes in, just say, hey, please, physician, please check that insulin box, because it's that easy.
Yeah.
Every lab, every clinic can do this test. It's just not on, they're not thinking about it either.
Yeah, I just had a blood test at Next Health. I think they measured it there.
They could have. So what you want to do is you look at your insulin, your fasted insulin, and ideally in US units, you want it to be 6 microunits per mil or less. Anyone for international audience, you want it to be under about 30 picomoles. That's the cutoff as we look across the different units. But even then, if you have your fasted insulin and you have your fasted glucose, which you probably do from that test, you can put that into a little equation called the HOMA, H-O-M-A, the HOMA score. And you want your HOMA score to be less than 1.5. And if so, then you're doing fine.